Again, hello everyone and welcome. I'm Crystal Leibarger, Member Specialist with the National Association of Addiction Treatment Providers, NAATP. We're pleased to bring our community together for today's webinar, Practical Solutions to System-Oriented Challenges, Integrating Cultural Responsiveness into SUD Treatment from Individual to System. At NAATP, we unite addiction and mental health treatment leaders committed to excellence in care, ethical practice, and strengthening behavioral health care across communities. Today's webinar builds on the important conversation that started during the NAATP National Conference session, From Stigma to Solutions, Advancing Equity and Inclusivity in SUD Treatment. Today's session shifts from awareness into action, focusing on concrete systems-level solutions organizations can implement to improve care and create more culturally responsive treatment environments. Dr. Gabrielle Jones will expand on her Cultural Responsive Substance Use Treatment, or CRST, framework, demonstrating how organizations can integrate cultural responsiveness into policy, workforce development, supervision, and direct clinical care. Attendees will walk away with practical tools that support accountability, improve workplace culture, and strengthen care for both patients and staff. A few quick notes before we begin. Today's webinar is being recorded and will be available on the NAATP website for on-demand viewing for NAATP members. The chat feature is disabled, so please submit questions throughout today's presentation using the Q&A box, and we'll address as many as possible throughout today's presentation and then again at the end. This session offers one continuing education credit through NAADAC and CADTP. Please complete the evaluation survey after the webinar to receive your certificate and receive a copy of the slides. We appreciate you taking the time to be here and for your continued commitment to strengthening equity, accountability, and quality in addiction treatment. Now I'm honored to introduce today's presenter, Dr. Gabrielle Jones. Dr. Jones is an award-winning licensed psychologist and the CEO and founder of Steady Clinical Consultation, Training, and Development Services. She founded Steady to improve substance use treatment for historically marginalized populations at the systems level and to support organizations committed to embedding cultural responsiveness into their workplace and workforce. Her expertise focuses on substance use treatment for youth and adults, workforce development, and implementing high-quality, comprehensive care across organizations. In addition to her consultation and training work, Dr. Jones serves in nonprofit leadership roles, including vice chair of the Miles High Foundation and board member for the Commission on Specialties and Subspecialties in Professional Psychology with the American Psychological Association. Dr. Jones is also the author of Culturally Responsive Substance Use Treatment, a guide for practitioners, students, and organizations, which introduced one of the first comprehensive frameworks for delivering culturally responsive substance use treatment at both clinical and organizational levels. Her work has been recognized nationally, receiving the 2024 ASAM DEI Award from the American Society of Addiction Medicine. We're grateful to have her with us today. With that, I'll turn it over to Dr. Gabrielle Jones.
Thank you so much, Crystal. And I am so excited to be here and really excited for the audience participation today. As Crystal mentioned, today's topic is practical solutions to system-oriented challenges, integrating cultural responsiveness into SUD treatment from individual to system. So let's get into it. Before I start all of my presentations, I conduct a land acknowledgement. For those of you who are not familiar with a land acknowledgement, it is a formal statement that recognizes and respects Indigenous peoples as traditional stewards of this land. It also acknowledges genocide and colonization of Indigenous people, their customs and culture. And the purpose of the acknowledgement is because it's one of many ways for us to put words into action and undo some of the oppressive educational practices that have been designed to kind of bury or re-narrate history. I am acknowledging the Miwok and Muwekma territories, also known as Concord, California. I am on the West Coast. So for those of you who were at the conference last week, it was good to see you all, but going from California to Florida is definitely a journey. So I am glad to be back home, but enjoyed myself thoroughly while I was there. So just to give you context so that you're prepared for how today is going to look, how this next hour is going to look, we're going to start with a foundation. It's important to me that we all have a shared understanding. We say cultural responsiveness a lot, but oftentimes we have different definitions for it. So we're going to start. I'm going to give you a very simplified version of how I define cultural responsiveness, and hopefully that will be helpful in driving the rest of today's presentation. Then we'll jump into what Crystal mentioned, the CRUST framework. It's a first of its kind framework. One has not existed up to this point, but we'll go into the sectors, its development, the components of it. We won't talk in too much detail about the CRUST framework as a comprehensive whole. What we're going to focus on is one sector of it, which is the systemic impact section. That's why you're all here today. We'll assess impact. We'll talk about what that means. We'll talk about the significance of our workforce in this work that we're doing, staff education, direct care, and then we will wrap up with discussions and questions. I will say before I go to the next slide that if you do have questions, please put them in the chat. I love the engagement of audience members. So if something comes up that you're curious about, do not be shy. We will have time at the end, but I'm happy to answer questions throughout as well. All right, so cultural responsiveness defined. At STEADY, we define cultural responsiveness is the conscious act of responding to the cultural needs of others. Full stop, period. The conscious act of responding to the cultural needs of others. So in corporate settings, that may mean responding to the cultural needs of the workforce as identified by the workforce. In mental health settings, that means responding to the cultural needs of the client as identified by the client, and so on and so forth. You're really focusing on the consciousness that you're putting in, the intentionality of how you respond based on what the person tells you or what the community tells you or what the workforce tells you in terms of how they are best served and supported. So that's the umbrella of cultural responsiveness, but there are two subcomponents of cultural responsiveness that people often don't note or recognize. One of those is cultural humility. And when I say cultural humility, simply I'm just saying acknowledging your limitations. You don't know what you don't know, and that's okay. Acknowledgement of that is a part of being culturally responsive because it opens the door for you to have more of those conversations to become more informed. The other component of cultural responsiveness is cultural awareness. And essentially, what we mean by that is understanding that your way is not the only way, that there are differences in how we solve a problem. We can get to the same destination from several different routes. And just being aware that that is a possibility or a component of how we can be more responsive is essential to the overarching idea of cultural responsiveness. So with that shared understanding of cultural responsiveness, the purpose of this talk is to talk about the integration of treatment from individual to system. And most treatment frameworks, most interventions, and most general conceptual frameworks focus on one or the other, not both. This framework really integrates both. the system as well as the individual client, the individual provider, and the system comprehensively. It was designed specifically to touch all areas of treatment. So what you'll notice is at the center, we have lived identities. I use the term lived identities rather than lived experience or identity because those two integrated is what makes us who we are. What do I mean by that? My identities, I have several identities, but some salient identities for me in this point in time right now are that I'm Black and that I'm a woman. Those are two identities I carry. But my lived experiences within those identities are what make me who I am. So, for example, my lived experience of being in the state of California is different from a Black woman's lived experience being from the state of Texas, is different from the lived experience of a Black woman being from Utah, is different from the lived experience of a Black woman who lives in Florida or in DC, and so on and so forth. So we can all be Black women and we share those two identities, but our lived experiences may be so different that we need to make sure we understand those components and complexities. So, for example, my worldview may look different from someone from the South. And so, as a treatment provider, I have to approach the same identified people in different ways. That also goes into the second sector of the framework, which is life stage. So life stage is broken out into four subsections: early adolescent, emerging adult, adult, and older adult. Because depending on your life stage will determine what types of interventions are appropriate. I'm not going to talk to a teenager about a 401k or becoming the CEO of an organization. That may be their trajectory, but in most cases, generally speaking, developmentally, an adolescent who is engaged in substance use is very different than an older adult who is engaged in substance use. And therefore, their treatment needs to reflect that. And that also goes and folds into their lived identities. So life stage and lived identities intersect because, for example, if you are an older adult, say let's keep this Black woman identity constellation together. So if you're an older Black woman in your 60s versus a younger Black woman in your 20s or 30s, maybe you are a new mom or a new parent or a new spouse. And if you're dealing or talking with an older Black woman, maybe you're approaching retirement. Maybe your friends are passing away. So the intersection of those two things really help curate a more comprehensive, individualized, but still kind of standardized approach to how you deliver interventions. Then we move to recovery lifestyle, which is the third sector. And that is really where if it's the desire and design of your program or of the people you're serving, this is where harm reduction might live. So the recovery lifestyle really poses the fact that if we tell someone that they need to do something that isn't aligned with what their lifestyle and their life experience is in that moment, they're less likely to achieve recovery. What I mean by that is in San Francisco, the unhoused population is exponential. And many people who are engaged in substance use are using for safety. And their recovery lifestyles then needs to match the fact that they are trying to prioritize being safe. And so, what your treatment plan looks like will be more curated to the needs of the client, which is wrapped up in the culturally responsive lens, because you're taking into context what is their desired lifestyle? What do they want to achieve in life? How do they want to move forward? What do they want to see? And how do we develop interventions that help achieve those goals? And sometimes that's where harm reduction ends up existing. And then last but not least, we have systemic impact. And this is really where we're going to spend the rest of our time today. Systemic impact, the naming, again, very intentional, was chosen because oftentimes when we talk about things that are related to the system, we talk about barriers, we talk about harms, we talk about challenges. But the reality is the system has an impact in all ways. There are harms, there are barriers, but there are a lot of really good, helpful, productive components of a system. And so the systemic impact sector really opens the door for us to think about what good can our system do. It's also internally reflective of providers. So as a system, what role do I play as a provider in the system? How can I be an advocate? What has the system done for me? And what biases am I bringing in as a result of the system or as a result of my own experiences? So this, if you take nothing else with you today, taking the assessing impact is going to be your best friend. This is where the practicality lives. And this is why systemic impact is named systemic impact. It leads to these four basic questions. What is or has been harmful? What is or has been helpful? What resources does the system have? And what resources does the system need? So, what's been harmful? What's been helpful? What do we have and what do we need? Those four questions will take you very, very far in the context of prioritizing culturally responsive treatment. So, let's start with what is or has been harmful. In many cases, and these are just examples, but I encourage you to go back to your organizations and think and reflect on what has or what is harmful for the communities that we're serving or for the workforce. So lack of staff representation that is and has been harmful in the mental health, behavioral health space. Representation, whether it be race or ethnicity, sexual orientation, gender identity, or disabilities, or whatever else, anything that is not representative. And then stigmatizing language has been harmful. We've really, in the substance use world over the past decade, have started to scratch the surface around why language is so important. In a lot of my talks, I do go into detail around the significance of what it means to say certain phrases. And in the professional space, where we want to make sure that we are not re-stigmatizing or perpetuating stigma. An example is through our urine tests. So historically, we've said they're either clean or dirty. And we all know that dirty is a negative connotation, clean is a positive connotation. So shifting language to detected or undetected neutralizes that. It removes the stigma and it says it's either there or it's not. It's not a value judgment anymore. And so when we talk about language, it has been harmful from a systems level. We have talked about abuse, which has implied that substances are something that people are just choosing to engage in, when we all know and research has shown that that's just not the case. So really looking again at those little things, those little slights, and how we can make sure that we're not perpetuating those stigmatizing words and languages and phrases to better adhere to the cultural responsiveness of the communities we're serving. And then examples of what has been helpful. Transportation vouchers through the roof. I mean, good grief. just having the ability to get from point A to my doctor's appointment is transformative. And that is a systemic impact. That is a benefit. Evening appointment offerings. I used to work at Kaiser. And for those of you who don't know, it's one of the largest HMOs in the country. And in the areas where the socioeconomic status was different, we would have evening appointments in groups available so that people could get home, feed their kids, get off of work. They didn't have to take off of work. And that was a systemic impact that was tremendously helpful in increasing the likelihood that people would be able to come to treatment. Question number 3, what resources does the system have? I used to do program development for adolescent recovery services, and that snack budget was heaven for me because if anyone works with teens, you know you get a teen in the room when you have some snacks. So having a snack budget is an impact that the system can have to bring people in the door, to make them feel more whole, to make them feel human, and making sure you have the right snacks because trust and believe I had some healthy veggie sticks and I got chewed out for it. So we want to have snacks that are good, but also be mindful of your audience when it comes to snacks. Community engagement and outreach department. Now, this is really a systems impact. So everything I've talked about up to this point has been primarily individual, but when we talk about systemic impact at the systems level, what departments do you have that you've been underutilizing? If you have a community engagement and outreach department, perhaps you can check in with them and share material so that when they go and they outreach, they're more equipped to talk about your programming, to talk about the services that you offer in a more fluent way rather than going out and just having a meal and listening, but not really having the wherewithal to talk about the amazing work that you all are doing. And then last question is, what resources does the system need? So an example that I put here is job training for clients. For those of you who have been following the OBBB implementation for Medicaid, next year is going to be really different. January 1, 2027 is going to put a strain on the finances that many of your organizations depend on to deliver life-saving services. One of those things is the job verification for clients. And so a systemic impact that you could potentially employ is identifying if there is a resource within your system, within your organization, if you can do one or if you can partner with a company to have job training for clients or job pairing or resume rebuilding, anything to even take a step to help your clients so that they don't lose their coverage. This is where you can identify where partners exist. Oftentimes, I talk about libraries. Libraries are such an underutilized resource, but they have so many resources for our clients to utilize. And if we partner with them, that becomes a bridge to resources that maybe you don't have as an organization, but that they have that you can leverage and vice versa. Um, these brief assessment questions will give you direction for how to better support clients and for how to improve as an organization. So when we talk about organization-wide, we want to look at what are some organizational approaches that we can take. What do we need to do? What might be beneficial for us to leverage in our policies and procedures, and so on and so forth, when it comes to cultural responsiveness. So again, the CRUST framework is so intersecting that you can break it apart, put it together, but they all kind of inform one another and are rooted in that ideal of cultural responsiveness. And when we're referring to policy in the CREST framework, we're referring to policies and procedures for the work, as well as informal organizational strategies for recruitment and care quality. So, for example, an organizational approach that you can take to embed cultural responsiveness at the system level, taking into context lived identity and life stage, is increase the flexibility of services. So, when and where clients receive care, whether that looks like home visits or coffee shops or central locations, rec centers, that they receive services where you are going to them as a resource, you as an agent of change within your system, advocating for additional time so that you can make it to point B to see your clients, rather than expecting them to just come to you, is a flexible approach to increasing services, delivering people what they need when they need it, where they're at. A second way, when you're folding in lived identity and life stage, is diversifying the ways of getting to the clinical hour for reimbursement. So you may be asking, what does that even mean? Like, we have our clinical hour, it's in the office, we're sitting there, we do our assessments and so on and so forth. But perhaps while you're in your session, you're playing mahjong, or you're playing spades, or you're playing dominoes. I used to work with youth quite a bit, and I had an Uno game set, but I wrote questions on the Uno game set so they could either draw cards or they could answer a question. And that is how I got my clinical hour met, while still identifying and being attuned to the life stage and lived identity of the person across from me. Is recognizing what would make them more comfortable. Is it snacks? Is it dominoes? Is it spades? Is it mahjong? Whatever the case may be, but really understanding your community and what they do in their spare time and bringing that in. And then at the systemic impact level, again, when we're looking at recruitment and care quality, you can recruit through special interest organizations, because that increases representation on staff, which addresses the first question that I had in the previous slide. But also, you're raising awareness that you exist. So if you go to the National Association of Black Social Workers or the Asian American Psychological Association, these or National Black Counselors Association, these are organizations that exist and have hundreds and thousands of trainees, early career professionals, mid-career professionals, late career professionals who are looking for you. Chances are you're here in this webinar because you really have a desire to contribute to change in such an uncertain time. And I truly commend you for being here. And take that a step further. Send your outreach teams to conferences that are special interest organizations so that you are more visible to them and they are more visible to you. You're already sending your outreach teams out to these conferences. Just be more intentional in curating what that list looks like. So you're not taking money from somewhere, you're not adding, you're just diversifying. Care quality starts with your materials. So this is a systemic impact intervention organization-wide that is often really underutilized as well, because your outreach materials really tell a story about who you are. I've had countless people come to me and say, oh my goodness, the hummingbird, the colors that you use, it's so vibrant. It means so much. Tell me more. That's a conversation starter, but it's also representative of the fact that my company is rooted in cultural responsiveness, and that's what we want you to see. Are your materials translated in different languages? If not, is that feasible or possible? If they were translated into different languages, would it still make sense? That's one thing that a lot of people don't think about. If your materials are just translated, but it doesn't make sense in a different language, you're kind of doing a disservice. Who is represented on your promotional materials? Where are you going to inform the community about your service offerings? Are you going to churches? Are you going to senior centers? Are you going to YMCAs? Are you going to rec centers and public events where you can table and kind of share a little bit about what you do? These are just a few things that really bulk up your care quality from a culturally responsive lens and take a systemic approach. So this isn't an overhaul of all of your materials, but perhaps your materials don't put people on them. Maybe they put images rather than people so that you're not running into the if we don't represent everybody, then we represent nobody conundrum. Or perhaps you have a few with options for others digitally so that you're not wasting paper or spending so much to try and recreate materials. Uh, our artificial intelligence has done quite a bit and it's come a long way. I was at a conference a few weeks ago and there was a vignette that the presenters were talking about. And they actually put two of the same picture up on the screen, but one was a black leg and one was a white leg. And they were talking about how rashes show up differently on different skin. But they created an AI generated mirror of a different complexion with the same image, which was insane to me. But in some cases, if you're running tight on funds, you can leverage the technology to your advantage and create materials that are more representative without having to go out and really pay for any additional stock photos or things of that nature. So the second half of this talk is going to transition into the workforce. So oftentimes we'll get into spaces and we'll say, well, we just want a good workforce. But today we're going to talk a little bit about why it's important, why it's so significant for us to prioritize a well-rounded workforce within our system, not just people who do the job well, but people who look different, people who think different, people who can all contribute to the same goal and mission. So if you were at the presentation last week at the NAATP conference, we presented a vignette about Marcus. And Marcus was a Black man who was in senior leadership and started to feel like he was not being appreciated. His ideas were being overlooked. He was not being considered for advancement. He made recommendations about diversifying their service offerings because he saw a need in the community of cultural responsiveness. And the responses were less than ideal. Additionally, Marcus was known on the unit and with the teams that he was really good at de-escalating clients. And so he had very specific skills that were serving the organization well, but he started to feel kind of like a token, kind of like one of these representatives when other senior leadership would come in or when they would get audited. And so Marcus started to feel discouraged in his space. What I'm describing, a lot of these things are microaggressions. I could do a whole talk on microaggressions. If you're not familiar with what those are, I encourage you to take a look. But essentially, small, slight, intentional or unintentional that impact the well-being of another person. So I shared this vignette, I set it up because we're going to go into the systemic impact as it relates to the employee trajectory. So as I mentioned, systemic impact really touches on the organization at all levels. And so when we're talking about employee trajectory, this is the path that you can expect when you are ignoring or minimizing or diminishing the significance of having a well-rounded and representative workforce. And so I'm not going to go into all of these in depth, but what you'll notice is that at each kind of stage, you have the employee behavior, you have the organizational impact, and you have the financial and quality costs. And so we start with this initial friction. I'm sure you've recognized this in your clinics and your spaces at your companies where there is some discouragedness, or maybe the provider or your workforce is rubbed the wrong way, or you're starting to see some changes in their behavior. And generally speaking, this is when they're feeling dismissed or ignored. And so what starts to happen is they silence. So the employee that used to have all the ideas and was encouraging and supportive slowly starts to retreat and stop talking. And because of that, you start to develop this echo chamber, and everyone's saying the same thing because the people who were bringing in different opinions and thoughts don't feel valued. And so their thoughts are now staying within them. And then you have this potential that's just wasted. It's just kind of sitting there. And when we talk about burnout and we talk about our workforce being kind of taxed, this is part of why, because those diverse ideas, those creative ideas are not being um, cultivated anymore. And then we have pivoting, where productivity starts to decrease, and you have to start placing people in more supervised, they need more supervised time. So maybe they need to be on a performance improvement plan because they're starting to make mistakes, or they're starting to miss things because of the fact that they are not feeling supported in their environment. So it's a tax on you as a leader and your organization. And this is, again, where the burnout becomes really substantial from a workforce perspective. We transition to external validation. So a lot of times what this will look like is they used to be called water cooler conversations, where employees or coworkers would congregate around the water cooler and talk about the things that they were annoyed by or the things that they were challenged by. But this creates a workplace culture that becomes toxic over time. So what may be innocent initially becomes a big problem very quickly, because if you've worked in any organizations that I've worked in, you'll know that word travels fast, especially when it's negative. So we want to kind of curtail that and make sure that we're not reinforcing this external validation when things are going wrong. And at this point, this is where leadership really needs to take a step back and say, are we culturally responsive? Are we safe people? Is there someone safe within the system that someone can talk to and get sound redirection rather than just aligning with them? And again, other minoritized staff become concerned. They start to distrust the organization. And then funding towards Marcus's training is wasted, because when you onboard, as you all well know, there are funds associated with training and onboarding someone new. And if they're not utilizing those skills for your organization, then it's wasted. And that's a financial loss. And then that leads to resignation and vacancy recruitment. And those are probably the biggest financial strains and uh, labor taxing components of the employee trajectory when we're talking about our well-rounded, diverse communities of employees in the workforce. But what you'll notice is you could have addressed this 3 stages beforehand. So you want to keep in mind and pay attention to those small behaviors so that you can address it, so that you don't get to the resignation or vacancy recruitment phase where you have to pay for temp staff or you're overworking your existing staff, because that becomes a snowball effect and only causes more problems. So the question may be, but why does this matter? Why are we focusing on the workforce? We should be focusing on the clients. In essence, if you're focusing on the workforce, you are focusing on the clients. When we talk about diversity in focusing on the workforce, when we talk about having a well-rounded workforce, you are addressing profit and retention, you are addressing decision-making, and you are addressing service delivery. McKinsey and Company noted in 2023 that organizations with more board level gender diversity are 27% more likely to outperform their competitors on profitability. That is a very stark data point. Gender diversity is critical for outperforming your competitors at the board level. So not just gender diversity at the staff level, but at the leadership level. Organizations with more executive level ethnic diversity outperform by 39%, even higher. And of the next generation of treatment providers, 76% of them reported a diverse work environment is important to them when they're evaluating jobs. And that's from Glassdoor. So the next generation of treatment providers want that workforce. They want to be in community, in a workforce, in a place where people look different, think different, behave different, live different than them. That's not a bad thing. That actually increases your competition and your profitability. When we think about decision making, so say profitability is not the priority, but we want to make good decisions for our communities that we're serving. According to Harvard Business Review, diverse teams make better business decisions 87% of the time because they're not hindered by the homogenous thinking or outputs. They're not in an echo chamber. That difficult dialogue, that tension that comes to come to a solution in decision making is necessary and critical for the betterment of business decisions, of business making. Additionally, diverse teams reach decisions faster, eliminating the unnecessary meetings and productivity lagging. So when you're dealing in teams that have different schools of thought, you get to a resolution faster because you're not saying the same thing over and over again. Additionally, innovation, which generates higher revenue, is more likely with diverse management. And that's from the Boston Consulting Group. So again, we're not just talking about our workforce staff, we're talking about leadership, we're talking about boards. So it's important to make sure from a logistical standpoint, from a profitability standpoint, from a competitor standpoint, that we have a well-rounded workforce. And finally, in the area of service delivery, organizations with diverse leadership are 70% more likely to successfully access new markets. I wonder why. Because of the thinking, because they're thinking of different places and spaces. They exist in different places and spaces. And so the ability to even recognize that there's a market in a different area comes from that variety of thought and that variety of representation. For substance use treatment programs, this looks like the increase in patient utilization of services, and team members have expertise in different areas, which makes for more robust and comprehensive programming. So what I hope you take from this is having a diverse workforce helps our organizations and our clients. You improve quality of care from a culturally responsive lens when you prioritize the diversification of your workforce. And the force data through NAATP has said as much. All right, so let's move into staff education. This is one of the biggest pitfalls of organizations because we have workforce training and we often forget skill reinforcement. So you may be wondering why I have a picture of these coffee mugs. One of my early jobs in life was working at Starbucks. And I loved it. I got up at 4 in the morning to open the store. I am a bubbly personality. I am a morning person. So I really enjoyed memorizing people's orders, making them smile, starting their day off right. I use this example for staff education because the Starbucks model of training is incredible. And what you'll notice is that you can go to any Starbucks in the country and get the same flavor of drink. If you want a caramel macchiato, that caramel macchiato at every Starbucks is going to taste the same because of the way in which they train their workforce. So when I worked at Starbucks, I learned how to make the basic drinks. So, how many espresso shots go into what particular drink. So if you have a tall, it's one. If you have a grande, it's two. And if you have a venti, surprisingly, it's two. I don't know if you know that. It's not a trade secret, but two espresso shots. So get a grande if you drink coffee because it's strong. Anyway, so that was their mechanism, 1, 2, 2, right? And then the milk. So you have a system that's an automated process. The steamer does the work for you. All you have to do is pour the milk in there. And then after you get the espresso in, you pour the milk in, and that's when the flavoring comes into play. So if we're making a macchiato, you do the zigzags across and you do the zigzags up and down, and you call it a day. So I bring this up because I was trained on the basics around how to make a drink. But because I was doing it often, the skill reinforcement was there. I was able to practice. If someone came in and said, I want a venti caramel macchiato, flat, no whip, extra foam, then that threw me for a loop because my brain had already learned that in order to make a macchiato, I need 2 shots, I need milk, and I need caramel. That's it. But now you have this diversity in what the desires of the customer is. And every customer has a different order. But there are a few key similarities. And in similar spaces, when we're talking about staff education, every staff member has a responsibility. Every staff member has the same base, but they may need to tweak things a little bit. And that's how the CREST framework really lives because you're able to look at, okay, where do I need to focus to tweak? Do I need to focus in their lived identities, in their life stage, in their recovery lifestyle, all three? And how does the combination of those things make the treatment more effective for the person? And that's where training becomes really important because you have to learn the foundation of things, just like at Starbucks, I had to learn the foundation of what drinks had, and then the skill reinforcement. And this is where maybe you have small groups where people can workshop some of those challenging cases that they're not familiar with. Maybe that's where you workshop the new coffee drink that you've never heard before. Additionally, every staff member has a responsibility, but communication across responsibilities is how you get to your desired outcome. What I mean by that is at Starbucks, if you have someone taking an order, their communication responsibility is to write the order on the cup. If there's no order written on the cup, you're stuck. So that the person taking the order is critical in the success of the outcome of the drink. The person making the drink needs to understand the language by which the person delivering the order is speaking or what is written on the cup. So that's a learned skill. That's skill reinforcement as well. And then you get to the end to the drink where the person can get it. And when we're talking about substance use treatment, it's similar. Your utilization review team and your clinical team and your people resources team, they need to understand each other. They need to understand what they do. That makes you an advocate in your system because you're able to understand who does what and who can go where and how you can get resources, right? Additionally, having support from your colleagues and peers and from your leaders helps with that skill reinforcement as well, which is why supervision tends to be very important. And then finally, we'll transition to direct clinical practice. So when we're talking about clinical care, we go right back to those 4 core questions that I hope you leave with today. What is and has been harmful? What is and has been helpful? What resources does the system have? And what resources does the system need? So when we're talking about direct clinical practice and clinical care, a one-size-fits-all approach does not work. We are not a monolith. as people across the board, we have different needs, we have different goals, we have different desires, we have different life experiences. And so a one size fits all approach is not going to work. The coffee is not just coffee. We all have different ways in which we like our coffee or our tea or our bubble waters. We might like LaCroix, we might like Waterloo. They're the same, but they're different. So we can't necessarily live in a one size fits all approach. But what we can do is say one foundation. And that's kind of where the crust framework lives. We have a foundational shared understanding. Another thing that's harmful is limited offerings to meet cultural needs. So perhaps you have no offerings in your programming, or perhaps you have a few, but you don't have anyone to run them. Maybe they're not a priority. So again, you are impacting your bottom line because you're losing a whole group of clients who need the help and can improve your numbers. What has been helpful? Meeting them where they're at. We all know this. We all know that meeting people where they are is the best way to help contribute to positive change when it comes to substance use treatment. And the system has done that. The system can do that. And seeing the whole person, not just components of them. I am more than just a Black woman. I have so many components of my identity, and so do all of you. Whether you want to share them or not is up to you. But maybe you like roller skating. Maybe you like going curling. Maybe you like sword fighting. Who knows? Maybe you like wrestling. There are several things that make us who we are. And so, what the system can be more helpful in is seeing the whole person. What resources does the system have? One of the best clinical resources in direct care and practice is pharmacotherapy. So if you have a physician on your team or MD, DO, psychiatry, whatever, if you have someone on your team, as well as peer support specialists and psychologists and LCSWs and case managers, if you have a truly interdisciplinary team with pharmacotherapy and substance use treatment, you are in a good position to serve your community well and culturally responsively. Additionally, if you have case management, that is, again, a really underutilized resource at the system level because you can have people do the case management. That's their job, to help people connect to resources, connect to the libraries, connect to the community centers, connect to the senior centers, or whatever the case may be. And whenever I partner with case managers, and I say partner intentionally because you really do have to partner with people, my clients have not gotten lost. They haven't fallen through the cracks. And we're spreading the load of responsibility. It's not just on me, it's on all of us. What resources does the system need? So in this case, for direct clinical practice, maybe you need more space. Maybe you can't serve your population because you just don't have enough room. And so I have Samaritan as an example. Mark Lasco presented last week and made such an impact on me because he was speaking my language of the systemic impact component of culturally responsive substance use treatment. He went out and he said, how do I get funds to help serve the community of downtown Nashville? He figured out that opioid abatement funds had money specifically for capacity building projects. He partnered with a affordable housing developer, again, partnered, did this in collaboration. And now he has a full 5-story building for long-term recovery services, workforce training. They have a coffee shop on the first floor where their graduates can come and work and obtain their own, get their own stuff if they want. And it's incredible. It's just a beautiful ecosystem. But because he thought about this one question, what resources does the system need? And he used that to inform the approach that he took. It's an incredible story. Highly recommend you all. He has said that he wants people to go visit. It's right in downtown Nashville. If you're there, highly suggest. But with that, I'm going to wrap with an opportunity for questions. If you'd like to learn more about the CRUST framework and the CRUST certification, you can scan this QR code or about Steady, and I will pass it to Crystal.
Thank you so much, Dr. Jones. Incredibly thoughtful and practical. We're taking a lot away from today. As you said, we're going to move into the Q&A portion of today's webinar. If you haven't done so already, please submit your questions through the Q&A box. As a reminder, the chat feature is disabled, and we're going to get to as many as we can in the next few moments. Dr. Jones, let's kick it off with this question that came in. You spoke about integrating cultural responsiveness at the systems level, not just the clinician level. What are some signs that an organization may still be approaching this work too narrowly?
That's a great question. I think that oftentimes organizations will focus on one versus the other, and that in and of itself is a narrow perspective and approach. What I mean by that is if they're focused on their workforce because they're getting all this feedback, and before I even answer this question, I do want to acknowledge that being in leadership in this time in this profession is like drinking from a fire hose because we're getting stuff left and right. So this is never to say that an organization isn't doing enough, because if you're trying, that's something. And my job is really to help you get to the next level. But one of the pitfalls I've found is ERGs, so employee resource groups. Those are great as a resource. But what organizations fail to realize is we already don't have time to go to these meetings. It ends up being more work because we are now responsible for hosting, planning, leading, facilitating, so on and so forth. So you're adding to a plate that's already full. And then leadership wonders why it's not working or wonders why people are still upset. And it's because you put in the mechanism, but you didn't put in the resources for us to utilize it. And so I think that that's a narrow approach. Simply having groups that are labeled for specific populations is quite narrow because there's not really an intentionality around one, is that what your community's asking for? And two, understanding why they're asking for it. Are they asking for it because they feel like they need a space to just collaborate? Are you the best fit for that? Maybe partnering with an organization that does that on a regular and pooling resources to go for grants where you can partner and collaborate will give more funding for both of you. So I guess the short answer would be going at it alone is the narrow approach to organizational change. So one of my biggest kind of phrases, if you want to go fast, go together. I mean, if you want to go fast, go alone. If you want to go far, go together. And so opening your eyes to see that there are partners who want to do this work alongside you and maybe better equipped so that you're not taxed and your resources aren't completely diminished would be the best kind of first step, I would say.
Thank you, Dr. Jones. So we are up against the clock. That looks like all the questions we're going to have time for. If you could go ahead and advance to the next slide. Again, thank you, Dr. Jones, for sharing your expertise and practical guidance with our community today. And thanks to everyone who joined today for practical solutions to systems-oriented challenges, integrating cultural responsiveness into SUD treatment from individual to system. Before we close today, just a few quick reminders. Today's session does offer one CE credit through NAADAC and CATTP. Please complete the evaluation survey after the webinar to receive your certificate. Today's webinar was recorded and it will be available soon on naatp.org. And as we continue these conversations around organizational change, workforce development, and operational leadership, we also want to invite you to an upcoming NAATP series focused on a topic many organizations are actively trying to navigate, artificial intelligence in addiction treatment operations and leadership. Over the next several months, NAATP will host a series of practical conversations focused on how treatment organizations are realistically approaching AI. Upcoming sessions include AI reality check. How ready is your organization and what to do next on June 25th? Member to member, low risk ways to use AI now, micro use cases to accelerate existing work on July 9th. And then our CEO to CEO, Leading with AI, your 3-year vision and 90-day foundations plan on July 23rd. All upcoming NAATP and industry events can be found under the Our Events tab on naatp.org. On behalf of NAATP, thank you for your commitment to improving addiction treatment through leadership, accountability, and culturally responsive care. Have a wonderful afternoon, and we look forward to seeing you at a future event.
Thank you.